The United States and Europe have been seeing a surge in daily COVID-19 cases linked to Omicron's two subvariants, BA4 and BA5. Officials say the new subvariants are spreading more quickly and could lead to more hospitalizations. Should we be concerned in South Africa? Let's unpack this further with Dr. Nicholas Crisp from the Department of Health. That's my first question, Dr. Crisp. Should we be concerned?
Good evening, and good evening to the viewers. No, we shouldn't be. We have had BA4 and BA5 for a couple of months already, and they were responsible for the largest part of our fifth wave. So we are very familiar with BA4 and BA5.
So seeing that it wasn't a very traumatic rise or surge in cases from BA5 here in South Africa, what do you think is happening in the US and in Europe, where there seems to be a lot of worry about these increasing cases?
Well, I think that what we see is that each variant behaves differently depending on the immunity in the community. What we do know is that both BA4, but particularly BA5, has had what the virologists and epidemiologists call immune escape. So it depends on the immunity in the community generated by whatever they've been exposed to before, and the structure of this particular variant's binding capabilities onto the human cells. So we have had the BA1, 2, we didn't really have much of a BA3, but now BA4 and 5 were from week 11 quite dominant in our cases that we saw. And it seems that with our immune response from both of the vaccines that we've been using and from previous exposure to the virus, that our communities were reasonably protected, certainly from serious illness.
So even in terms of much freer and more open travel to the US and to Europe, and the fact that we're no longer required to wear masks in public spaces, there's still no need for concern, correct?
Well, I think we should know that COVID-19 is still very much around. The variants have changed. We've been reporting on that, and I think everybody is familiar with the fact that this virus mutates. This was the first time that we've seen a surge or a spike that's been, or a wave that's been attributed to a subvariant and not a new variant. The virus may well still mutate. So we should be concerned, and we should get vaccinated, and we should, if we are vulnerable as individuals in any community and have other illnesses, be protecting ourselves with masks and with social distancing, and just being well aware of sanitary arrangements wherever we are, particularly in close contact with other people. But the vaccines work well. Both the vaccines we use, repeated vaccinations when there's waning immunity, does bolster our immunity, and it generates cellular immunity, which is what we want to see, sustained, better immunity than just an antibody response.
Well, certainly what we wanted to hear. Thank you very much. That was Dr. Nicholas Crisp from the Department of Health telling us that there is no cause for concern. Given if you are vaccinated, if you're not vaccinated, go and get vaccinated. And if you haven't had your boosters yet, that is still a very good idea. COVID-19 is still going to be with us for a while.